Hello, today we discuss some common human responses which are very high yield for NCLEX exams. First of all, we will discuss about some basics about vital signs. For first of all, for temperature, there are few terms like a febrile, in which the oral temperature is 97.5 to 99.5 Fahrenheit, and for rectal, it's 0 0.5 to 1 Fahrenheit more than oral root. Hyperthermia more than 99.5 Fahrenheit, and hypothermia is less than 97.5 Fahrenheit. Now pulse, what is normal pulse? It's 60 to 100 beats per minute. And what is tachycardia? More than 100. What is bradycardia? Less than 100 beats per minute. There are some patterns of the pulse uh, which we come across on feeling, like thready, it means weak and feeble pulse. Bounding means full and forceful pulse. Dysrhythmia, it means irregular pattern, like we will discuss about it in atrial fibrillation and SVT. Pulse deficit, it means there is difference between the radial and the apical rate. Respirations, normal, it means eupnea, it's between 12 to 20 beats per minute. Tachypnea more than 20, and bradypnea, it's less than 12 beats per minute. Apnea means absence of the breathing, and hyperventilation means increased rate and depth of respiration. There are few patterns of respiration, like small, it means deep and rapid, associated with metabolic acidosis. And chain strokes breathing, it means rhythmic waxing and waning from very deep to very shallow and temporary apnea. Orthopnea, it means upright position to breathe, which is very common in heart failure. Dyspnea, it means difficulty breathing, like in many lung diseases and heart diseases. Now blood pressure, which is normal less than 120, and systolic and diastolic less than 80 millimeter of mercury. There are few stages like pre-hypertension. It means systolic is between 120 to 139, and diastolic between 80 to 89. Stage 1 hypertension, it means systolic is 140 to 159, and diastolic is between 90 to 99. Stage 2 hypertension, it means systolic is more than 160 and diastolic is more than 100. Now we will discuss about fever. What is the definition? What are the signs and symptoms? What is the etiology, and what is the nursing precautions a nurse can do for fever? Now temperature is more than or increase of temperature of the body as compared to the surroundings. Low grade fever, high grade fever. Low grade fever is in between 98.6 to 101, and high grade fever is more than 101 Fahrenheit. What are the signs and symptoms? Fatigue, weakness, flushed and dry skin. What is the etiology? Etiology can be bacterial, viral, or the fungal infections. It can be due to the DVT or the medicine side effects, or it can be due to the tumor, which is the chronic fever. Now a nurse can monitor vital signs and WBC count through CBC. Evaluate medicines for possible drug-induced fever. Obtain diagnostic tests like sputum specimen, blood specimen, and urine sample for culture and sensitivity, or chest X-ray to evaluate the causes of fever. Perform focus assessments like decreased breath sound, crackles, bronchi in case of the chest diseases, stiff neck and headache, photophobia, irritability, and confusion in case of any CNS or central nervous system diseases like meningitis, encephalitis. Inspect IV site, incision, and wounds for infection in case of any operative. Legs for DVT like redness, warmth, swelling, and tenderness. Urine for infection like burning on urination, cloudy, greenish or reddish color. Any GI signs and symptoms like diarrhea, nausea and vomiting, and abdominal discomfort. Now a nurse After this history taking, she can do encourage coughing and deep breathing, increase fluid intake to reduce the fever. A nurse can give antipyretics, tepid bath, or hypothermia blanket to reduce high grade fever. A nurse can change IV site if it's indicated. This is all about fever. Now, in constipation, less than two stools a week are hard, dry feces, which term is called obstipation. Signs and symptoms are distended abdomen, rectal pressure, back pain, straining at stool, anorexia, blood-streaked stools, or decreased bowel sounds. What is the etiology? Urge is ignored. Decreased intake of fluid, decreased mobility, or decreased fiber in diet. Weak abdominal or the pelvic floor muscles. Constipation can be due to the medicine side effects like opioids, iron, or monoamine oxidase inhibitors. It can be due to anal lesions. It can be common in pregnancy. It can be due to laxative or enema abuse. Electrolyte imbalances are due to obstruction like intestinal obstruction, or in child it can be due to the stool withholding behavior. A nurse can assess stools for frequency, amount, color, and consistency. She can give the patient these advices like increased fluid intake, increased exercises, or increased fiber in diet like binding foods, rice, and bananas. Respond to urge, increase sitting position and regular time each day. Increased relaxation and privacy. A nurse can give laxatives, cathartics, enemas as ordered by the doctors. Now, diarrhea, it's passage of fluid or unformed stool more than 3 a day. What are signs and symptoms? Frequent loose stools, abdominal pain, cramps, flutters, nausea and vomiting, fatigue, increased bowel sounds like hyperactive bowel sounds, abdominal distension, anorexia. It can result in dehydration. Etiology can be viral, bacterial, or parasitic gastroenteritis, contaminated food or water, in resulting in food poisoning, spicy, greasy food, raw seafood, excessive roughage, lactose intolerance. It can be common in AIDS. It can be due to the drug side effect. It can be common in anxiety. Inflammatory bowel disease is the most common cause, like ulcerative colitis, bloody stools, Crohn's disease, watery stools. It can be due to the ingestions of heavy metals like lead and mercury. It can be due to the malabsorption syndromes. A nurse can assess stools for frequency, amount, color, and consistency like she did in constipation. Here, she can assess signs and symptoms of dehydration, which is very much important. She can encourage the patient to increase fluid intake. She can assess perianal skin breakdown and provide skin care. Basically, it's due to dehydration. She can assess antibiotic, stool softeners, or opioid use in patient. She can ask the patient about recent foreign travels and dietary intake. She can obtain stool specimen for culture and sensitivity, ova, and parasite. She can administer antibiotics like tetracyclines or antidiarrheal like loperamide through IV. Contact precautions as indicated. Now, hemorrhage. Bleeding that compromises tissues or organ perfusion. It can result into increased pulse, increased respiration, low blood pressure, narrowing pulse pressure, excessive blood loss, capillary refill more than 3 seconds, decreased peripheral pulses, cold, moist, pale, mottled, and cyanotic skin, and increased in thirst. What are CNS signs and symptoms? Early symptoms can be decreased loss of consciousness, anxiety, irritability, and restlessness. Late can be confusion, lethargy, combativeness, and coma. Etiology can be external and internal. In external, it can be surgical or the traumatic wounds. In internal etiology, it can be due to the blood trauma, cancer, ruptured aneurysm, GI perforation, like intestinal perforation, or gallbladder perforation, or appendicitis perforation. It can be due to the thrombolytic therapy. A nurse can apply direct pressure and reinforce dressing to reduce bleeding, to reduce hemorrhage. She can monitor vital signs, input and output, lab results. Maintain airway, give oxygen inhalation. She should ensure an IV line of 18 gauge IV access, give IV fluid, blood, or colloidal products according to requirement. Now, shock. Shock is basically acute circulatory collapse, which results in decreased oxygen to the cells, tissues, and organs. Signs and symptoms are decreased blood pressure, decreased urine output, capillary refill more than 3 seconds, cool, pale, mottled, or cyanotic skin. It results into change in mental status. There are few types like hypovolemic, which results into decreased peripheral pulses, neurogenic, which results into tachycardia and bradycardia, anaphylactic, which results into anxiety, throat tightness, stridor, tachypnea, diaphoresis, flushing, urticaria, and coma. Septic, it can result in fever, tachycardia, and tachypnea. What are the etiologies of these types of shocks? Hypovolemic, it is etiology can be blood loss, or etiology can be dehydration due to loose motions due to diarrhea. Neurogenic, it can be due to spinal cord injury, or it can be due to anesthesia effects. Anaphylactic, it can be due to exposure to the different type of antigens. Septic, it results from infection or endo or exotoxin release. A nurse can do emergency intervention like ABC, airway suction, and or oxygen via non-rebreather at 10 to 15 liter per minute. Spine with legs elevated unless airway compromised. If airway is not compromised, she can place the patient in spine position with the legs elevated to increase circulation to the brain. She should take IV access with 18 gauge, prepare for code intubation and ICU transfer. Ongoing assessment, she can do ECG. She have to assess the GCS, vital signs, pulse oximetry, input output, and she had to inspect the skin. Then she can do type specific management as ordered by the respective doctor. Now, infection, it's basically entry and multiplication of pathogen in tissues. What are the local signs and symptoms, and what are the systemic signs and symptoms? In local, erythema, edema, tenderness, heat, decreased function, and purulent exudate. In systemic, increased vital signs, tachypnea, increase in pulse, increase in respiration, increase in blood pressure. Chills, diaphoresis, malaise, increase in WBC count on CBC, and positive blood culture on culture and sensitivity. Etiology can be invasion of bacterial or viral or fungal pathogen. A nurse has to assess vital signs and symptoms, local and systemic. She has to obtain culture and sensitivity before first antibiotic. This is very much important. First culture and sensitivity, then first antibiotic or first line antibiotic or empirical antibiotic. She has to avoid excess bed covers, change linen if diaphoretic, means excessive sweating. She has to promote rest, give oxygen, IV fluids, increased fluid intake orally, increased protein intake, and increase in vitamin C to boost up immunity. She has to inform the patient about transmission of infection. Inflammatory response, it's basically a local defensive vascular response to injury, any infection, or any allergen. Signs and symptoms are edema, heat, redness, pain, and decreased in function. Exudate types, it can be serous, serosanguinous, or purulent. She has to assess wound characteristics. She has to elevate and immobilize the respective organ. She has to give the patient antibiotics, anti-inflammatories, or antibiotics. She has to use ice initially and then heat after 24 to 48 hours. Like a patient who fall from bed or fall from any building or fall from any site, he has developed an inflammatory response. Basically, he has developed a swelling, for example, on his forehead. He has to use ice initially for 24 hours, then after 24 to 48 hours, he has to use heat, like heat pads or heat gel massage. Now, nausea and vomiting. Nausea is basically unpleasant wave-like sensation. Vomiting is ejection of GI contents, not unpleasant sensation. What are the risks? After vomiting, a patient can develop aspiration leading to atelectasis, pneumonia, or asphyxiation, leading to the death of the patient. Signs and symptoms are nausea, vomiting, pallor, diaphoresis, and hyperactive bowel sounds. Etiology can be gastroenteritis, motion sickness, infection, pain, stress, or it can be due to medicines, pregnancy, or increase in intracranial pressure. A nurse has to do ABC, maintain airway, increased head side of bed or side lying, keep the patient NPO, assess hydration, input output or electrolytes, assess abdomen, and determine the cause of nausea and vomiting. Now, orthostatic hypotension, it means decreased in blood pressure when changing position. Like a patient is sitting and suddenly he is standing up, and then his blood pressure is decreased. This is orthostatic hypotension. Signs and symptoms are lightheadedness, vertigo, weakness, cool, pale, and aphotic skin. Etiology can be due to the older age, immobility, hypovolemia, anemia, dysrhythmias, or it can be due to the medicine side effects. A nurse has to assess the BP, blood pressure, and pulse of with position change. She has to ask the patient to rise slowly in dangle position. She has to assist the patient while doing this. She has to monitor the GCS of patient and the cardiac status of the patient. This is all about the common human responses of the patient in various diseases. Hopefully, you have liked this. Thank you.